Hi, I'm Dr. Charelle Carter-Brooks, and I'm here to talk to you today about coronavirus or COVID-19. Many of you are familiar with COVID-19 as it's become a part of our daily lives over the past 3 months, especially in the state of New York. COVID-19 is a novel virus, meaning that we as humans have never been exposed to this particular virus before. Yes, we've been exposed to other coronaviruses, but they have not been a strand that is similar to the one we are currently seeing now, which is called COVID 19. COVID 19 came from a market in Wuhan, China, we think sometime in December 2019. And the virus spread from an animal to a human host. They're not sure how that happened, either through eating the food or secretions, something like that. And Wuhan, China really was the epicenter of coronavirus. Um, Many experts did not think the virus would spread so rapidly and so quickly to the rest of the world, but it has at this point, many months later. And we all personally have experienced the devastation, both personally, physically, economically in our lives due to coronavirus. Um, and so it's been extremely challenging. What makes coronavirus so scary is that it is new. We don't really understand how to treat it like things such as other viruses, such as the flu, right? The flu we have a vaccine for. We've seen multiple different strands. We have medications we can use to treat that when people have it. In terms of coronavirus, there's no specific treatment. There are a number of drugs that have been reported on TV and even in medical literature to treat or help decrease the symptoms. We don't have a cure. There's more evidence that certain medications work better than others, but it's changing every day as more and more data is collected and analyzed from around the world. And things that initially they did in China, which we tried here in the United States, did not work as well. And so it continues to be an evolution. Overall, there have been over 2.2 million cases of COVID 19 in the United States. New York State, California, Washington State were hit the hardest out of the United States. And New York is still continuing to suffer. Overall, about 3% of people who get COVID virus or have been tested for it have died. And in comparison, only 1% of patients who have the flu will die. And that's probably because we've all been exposed to some flu viruses. We already have antibodies. And so the likelihood of dying is lower, especially if you get the vaccine. Coronavirus, we don't have a vaccine yet, and we probably won't have one for another year. And subsequently, if we are exposed in the future again, we should have some antibodies, which are special parts of our blood which fight infection so that we don't get as sick. The part that's been hard with coronavirus is that it's disproportionately impacted African American and Latino communities across the country. Um, Black and Latina people have seen more sickness and more death. And there's some thoughts as to why this is happening. The jobs that we have are more on the front lines, interacting with more people. So the more people around, the higher risk of your exposure. In addition, we have underlying diseases such as diabetes, hypertension, lung disease, obesity, heart disease that put us at risk for having more complications with the coronavirus. Overall, however, most people who are exposed will have no symptoms or mild symptoms. And so mild symptoms can include a cough, a dry cough, feeling tired. About 10% of people will have diarrhea or abdominal pain. And so those can be mild symptoms. There may also be an associated fever and shortness of breath. More severe symptoms are shortness of breath, where you actually need to go to the emergency room and be admitted to the hospital for oxygen and other treatments. And that happens in about 15% of people who do contract COVID virus. So most of us do very well. However, if you're somebody who falls in that category, that you have underlying health conditions or elderly, or even not even elderly, but just older, over than age 65, you're at higher risk of having complications or a more severe form of COVID virus. So what can we do to prevent COVID virus? I know there's been a lot of kind of controversy over mask, no mask. I think overall the consensus right now, according to the CDC and many local and state governments, is that people should wear a mask. Wearing a mask protects the person you're speaking to, basically, if you are carrying coronavirus and you don't know. So wearing a mask is not necessarily to protect yourself, but it's to protect other people from getting the virus. And again, there is a small group of people, about 15%, who are going to have the virus and are not going to have any symptoms. And that virus can stay in our respiratory secretions, in our lungs, in our airway for a long time. Even if you had coronavirus and the symptoms go away, you can still be shedding that virus. So you can still be contagious and infect other people. And so the only really good tools that we have right now are to wear a face covering. It can be a bandana, it can be a homemade mask, it can be a medical grade mask, but wear something when you're out in public or around people who may be older or ill. Wear a mask is going to cover your nose and your mouth, okay? Because that's going to prevent those secretions or droplets that come from your mouth and your nose. The other thing is constant hand washing and sanitizer use. This hand sanitizer needs to be at least 70% alcohol if you're going to use it. Hand washing is best with soap and water for 20 to 30 seconds. And you want to do that multiple times a day. You know, wearing gloves is somewhat controversial because if you're wearing gloves and you're touching a bunch of things and then people, that's not really helpful. You know, it's better to be washing your hands constantly if you have the option than using the same pair of gloves to go multiple places and interact with multiple people and things, because coronavirus can live on surfaces. And so even though this virus is scary, we're learning more and more about it every day. Those are things that we can do to protect ourselves. As states and cities begin to reopen and allow people to kind of go out and eat, go shopping, etc., entertainment, it's important to be mindful that the coronavirus is not gone, that people still will get it, and some people don't have symptoms. So even though it seems like it's safe because things are opening back up, there is still a significant risk that you could get coronavirus. And so if you're going to be out in public and interacting in public, it's best that you wear a mask if you can. Now with exercise, that's hard. So if you're going to run on a trail or be out kind of in an open space outside, a little bit less risk of those droplets being transferred from person to person because the fresh air kind of circulates. But just be careful if it is a crowded space because you can still spread coronavirus if you're outside. So I think the take homes about coronavirus is it's so dangerous because it's new. We don't have great treatments for it and we don't have a cure for it, and there's no vaccine, and that's going to take some time to find. It's also scary because it's disproportionately affecting our communities. And other than saying that, you know, our jobs are contributing or underlying health conditions, we really don't understand why we are at higher risk. And lastly, I think a lot of people have felt the, you know, economic impact of coronavirus, not being able to work, maybe not having childcare, you know, having your kids home and not being able to go to school, and psychological impact. And so a lot of people are having a hard time dealing with that and can have some mental health issues. And so if you're feeling down or sad or like you're just shutting down, you can reach out to your doctor or healthcare provider, a close friend. There are a number of resources available for people, even online, to talk to somebody if you're having a hard time coping. I think the best thing we can do right now is to try to support one another, and be smart while we're doing so by wearing our masks and washing our hands and trying to distance ourselves. Thanks a lot. If you guys have any questions, you can feel free to email me, or find me on Facebook or Instagram. My email is CHARELLE, M as in Mary, CARTER @gmail.com. Thanks.